Happy start of the week, everybody. I'm being asked about my opinion on the naked people seen on the streets in Dubai. I'm also being asked if this behavior is connected to the weather. I know you might feel you want to laugh, but those are your questions. All of a sudden, people are seeing naked individuals on the street in Dubai. So what is this? When does this start? What is happening? So you should know that sometimes people tend to break the social norms and rules, and this is what we call disinhibition. It's a type of a disinhibition behavior. It becomes evident. There's a lot of impulsivity there. There could be addiction in the personality, irritability, likely to commit antisocial behavior as well as antisocial diagnosis as well. The disinhibition syndrome correlates with atrophy in the orbitofrontal cortex as seen on MRI studies. So I really want this video to help you understand tactless behavior or offensive behavior. This behavior occurs when people don't follow the usual social rules about what or where to say or do something. So this type of disinhibition can definitely place enormous strain on families. It can be upsetting when someone who has previously as well been private and sensitive starts to behave in a disinhibited manner. So this will include, for example, tactless remarks, behavior. Dementia might also be a root cause of this disinhibition. It will appear that the person has lost their social behavior or etiquette. Harassment of other people can also co-occur. Bold behavior, inappropriate flirting or inappropriate sexual comments as well can be included. Exposure, it's when a person may take all of their clothes off. It can happen again with dementia, with schizophrenia. It can happen, of course, as well in inappropriate settings. Definitely it's about forgetting the social rules. There could be as well like whereby they publicly masturbate as well in front of others. So what causes these behaviors? I want you to know that this is for sure a sign of mental illness, and there are many reasons why people change their behavior. So every person is an individual who reacts to circumstances in their own way. There's no judgment there. So sometimes the behavior can be related to changes that are taking place in the brain. It could be factors in the environment as well, triggering the behavior, such as well change in the weather or any other environmental change. So my dears, it is quite important to understand why the person is behaving in a particular way. If family members and people who are caring for this person can determine what may be triggering the behavior, it can be, of course, easier to figure out ways for prevention and ways for treatment. However, if we don't have this kind of help, as doctors and specialists in psychiatry and psychotherapy, of course, hospitalization is indicated. So the person usually who behaves in a disinhibited way for sure has confusion, identity confusion. They may believe, for example, that their daughter is actually their wife. They can behave in a way with the daughter as if she's the wife. It is inappropriate behavior. Besides confusion, there is, of course, a type of discomfort. undressing themselves in public as well may be the result of discomfort, feeling too hot or cold, clothes are tight, removing the clothes in order to be more comfortable. For instance, forgetting the loss of skills, forgetting who the person is. For example, forgetting how to dress or the importance of dressing. They may need to urinate, but they forgot where is the bathroom or how to use it. So there's for sure loss of judgment, and this can be due to brain damage, due to dementia, disorientation, confused about the time, the place. They may really believe, things that are quite strange. They confuse the identity of people as well. So all those things really are there, and it is possible. Maybe you haven't seen them before, but those cases are quite prevalent and they are quite common. So it is very important. Of course, this is just an educational video to raise your awareness. However, for sure, this is very distressing, be it on the person himself or herself or the family. So it's very important for you to understand why someone is behaving in this way, and to always seek the professional help. So the doctor, in this case, we check if there is physical illness, we check if there is a medication that the person is taking that can be also a root cause. Remember that this is all part of an illness, and it is our job as professionals to assess and to realize what is going on, and to help the person and the family to navigate this illness in the best way possible. So if you have any other questions about this, kindly send them our way. And thank you for those who are always trusting us and helping you find the answers as well. Have a good day and a very successful week ahead.